Now, at the setting of the device, after we will get the prescription from the doctor, what's the best level of pressure we need to use it with the patient, we will set it. For me, mainly, I don't recommend that the patient will play with these settings because these settings has to be changed based on the doctor recommendation. Okay. Now, so I will just make the setting as the doctor will tell me, and I will ask the patient to keep following up with me because we have with our device something called SD card. This SD card will record the patient data during using the machine. I will ask the patient to keep following up with me every month. So every month I will download the data, then I will get a report and I will send the report to the doctor. So the doctor will keep following up with the patient, what's the patient case right now, if we need to readjust the pressure or what do we have to do the patient. Now we have some recommendation. We have to ask the patient to do it every time before he will use the machine. Now this will be more about the machine. So as I said before, I will set the device, okay? Then I will come to the patient to inform him about the main basic or basic steps that he has to do it every night with the machine. Now mainly with the device, we have attached a humidifier. Now this humidifier, it has a chamber. This humidifier chamber has to be filled with water every night.
Are we talking tap water or does it have to be filtered water?
It's recommended to be the distilled water.
So fresh water every night?
Yes.
Don't leave the water if the container has some water in it, throw it out.
Yeah, it's better to just have fresh water every night. Then he will just put it back. It's not important if the water is like cold water or hot water, then it will be the same because we have a heated humidifier for the machine. Then after that, you will have the tube. The tube, it's almost 1.8 meter, so it's enough to the patient if he can move at his bed. As well, it's 360 degrees, so it's very free to the patients to move as well.
And as a result of the movement, this tube will not tear or break or rip?
It will not be break because mostly as a life for this tube, it will be 8 to 12 months. As interface, as I said, we have mainly 3 types: the face mask and nasal mask and the nasal pillow mask. Now, as a face mask, as I explained before, okay, it's covering nose and mouth. We have it in 4 sizes: small, medium, large, and X large. As well, we have it for the nasal mask. We have it only as actually small, medium, and large. And the nasal pillow, we have it all in one size: the small and the medium and the large. After this, now we would prefer to try the machine on the patient himself.
Sure.
Ready?
Absolutely.
Okay. The face mask, it's covering nose and mouth. We have it in different sizes. We have a size gauge to know exactly what's the size for the nose of the patient, and based on that, we will give the patient the required size. Okay, so we have here the large size. The large size, we will put the mask in this way. We have a hook here, so it's easy to the patient to remove it. So just like this to remove it, and just like this to put it. Now to wear the mask is something very important to the patient. So if the patient he's using and wearing the mask well, then he will be in a comfortable way. If he will not wear the mask well, he will not be in a comfortable way, then he will hit the machine. So what he has to do is to tighten the straps from both sides, upper and lower, in the same level. This way, that's enough. It shouldn't be very tight. As well, the mask should be at the point of the nose exactly. Then after that, we will just connect the tube to the mask. All what you will have to do is to breathe normally. Breathe in, breathe out. Breathe in, breathe out.